This Monday marks World AIDS Day to raise awareness about HIV, which was contracted by 1.3 million people globally last year. The fight to curb and eradicate the disease has hit a roadblock with steep cuts in funding. The UN has warned that failure to restore prevention endeavors could result in an additional 3.3 million new HIV infections between 2025 and 2030. Today, nearly 41 million people are living with HIV worldwide, with children and young women particularly vulnerable, especially across the Africa region. Charlotte Hughes has the details.
After decades of progress, the UN has warned that the fight against HIV is at a crossroads. Ahead of World AIDS Day, the UNAIDS Executive Director stated that international funding cuts, including from the United States, have hampered the global HIV response.
Since the abrupt pause by the United States in February, the complex ecosystem that sustains HIV services in dozens of low and middle-income countries was shaken to its core. Clinics closed without warning. Thousands of health workers faced job losses or lost salaries. And life-saving testing, treatment, and prevention services experienced widespread and continuing disruption.
According to UNAIDS, the distribution of preventative medicines fell sharply since the cuts. It decreased by 31% in Uganda, 64% in Burundi, and 21% in Vietnam. Today, nearly 41 million people are living with HIV worldwide. 1.3 million new infections occurred last year, and around 9 million people are still not receiving treatment. Children and young women are particularly vulnerable, especially across the Africa region.
Across 13 countries, the number of people newly initiated on treatment has declined compared to last year. Stockouts of HIV test kits and medicines have been reported in countries including Ethiopia and the DR Congo. Prevention services, already under strain before the crisis, were the hardest hit.
UNAIDS has warned that the failure to restore prevention endeavours could result in an additional 3.3 million new HIV infections between 2025 and 2030.
Well, for more on this story, let's bring in Vincent Leclercq. He's the General Director of Coalition Plus, which is a federation of NGOs globally, which aims to remove barriers to accessing health services in order to end HIV/AIDS. Thank you so much for being on set with us. Of course, so give us a sense from your point of view of the current trends that we're seeing when it comes to global HIV infections. The word setback was used earlier. Just how dangerous a situation are we in?
Until 2024, we've had great results on the HIV epidemic. Life expectancy of people living with HIV is nearly the same as the rest of the population. The number of new infections was declining a lot, number of deaths as well. But what happened in January 2025 was a blow for the HIV response. And now the situation is still unclear, but there are models from UNAIDS that say that until 2030, there will be an additional 2 million new deaths and an additional 4 million new infections because of the cuts. It's indeed a very bad situation for the HIV response. And last year we were very optimistic. Now we are no more in condition to reach the end of the HIV epidemic.
You mentioned January 2025. Just to make this clear to our viewers, this is the arrival of Donald Trump at the White House in Washington, D.C., and his decision to completely cut back on any international aid efforts. Can you give us a clearer picture of how this situation affects young people specifically?
Just to mention that the US funding was paying for the whole supply chain of access to treatment, access to prevention, access to testing. And all the populations are affected by the disruptions of service, among which young generations. But moreover, this situation adds some more misinformation and the idea of that HIV is no more priority. And as we all know, that we lack information for the younger generations. We need some more additional information, but this situation is misleading people, saying that HIV is no more priority. So the consequence is that people are less informed, people have less access to treatment, people have less access to testing, and this will have an effect on the long term on the HIV epidemic.
You mentioned information a number of times. Yes. Are young people today just not as informed? Are we having to debunk old myths about HIV/AIDS once again, and now with this new generation of people, basically?
I wouldn't blame young generations. I think we need to evolve in the way we communicate toward young generations using social media, influencers, but also this situation is also because we have had great news on HIV. Like life expectancy is better. We have PrEP. PrEP is a medicine that is 100% efficient to prevent an infection. So we have all this good news. That's maybe why people think HIV is less a priority and there is less information. But also, we are in a world with kind of a conservative wave. And it's every day harder to do prevention at schools. There are strong conservative movements with a lot of money having an influence in many countries on policies, on health policies. There are even new laws against homosexuality, for example, in many countries. And all those conservative initiatives pile the pressure on HIV programs.
There must be so much frustration to see how much progress has been made over the years and to now be dealing with these setbacks once again. What can be done apart from calling and lobbying for more aid, for more funding? How do you adapt your work to this new context with less financing? You've just come back from Colombia, for instance, where you were leading initiative there.
Well, today we are launching a campaign, a still standing campaign, because we want to show that we are still positive, and we are people living with HIV. We are people from the communities, and we won't stop the fight. So yes, in Colombia, we launched the International Testing Week. That is an annual event to remind everybody, remind policymakers, to remind also the communities and people that doing a test is something essential to know your HIV status, to have access to treatment. So we should often organize such events to remind the population that the HIV epidemic is not over. As you mentioned, there are still 41 million people living with HIV. There are an additional 1.3 million people contracting HIV every year. So the epidemic is not over. So please, everyone, get tested.
Just one last question here. I mean, we've mentioned the importance of information. People don't necessarily have all of it. Can you just remind us about the treatment options available for people living with HIV/AIDS? And obviously remind us, where do we stand in terms of accessing those treatments?
We are living a revolution regarding HIV treatment now. We have lots of options. So someone contracting HIV, being tested, can be on treatment the same day of the diagnostic. And the life expectancy will be the same as everyone, which is very good news. But also someone under treatment won't transmit HIV. And in the future, there will be new treatment coming, like 1 pill a month or 1 injection every 6 months to not take an oral pill every day. That are very good news, but we need to continue research. We need to continue the efforts on prevention, but also on surveillance. And all those 3 areas are under pressure now because of the budget cuts.
Vincent Leclercq, you're the General Director of Coalition Plus, a federation of NGO that works towards removing barriers to accessing health services. Thank you so much for sharing your insights on France 24.
Thank you very much.